One.
Okay, awesome. So thanks to everybody for tuning in to the Great Health Debate Season 3, The Promise and Peril of Cultural Competency. So I'm one of the executive producers of the show, did Season 1 and Season 2, where we had very different lens that we looked at. This season was cultural competency. Last season was global health and a lot of the topics there. And then Season 1 was a potpourri. But Fatou, as the host and also co-executive producer of the show, what did you think of all of the 4 episodes?
Yeah, I think these discussions were great and very fruitful. And the main thing I took away was that these issues are much deeper than we think, and they're not surface level. I really loved the diverse backgrounds that we had with the panelists. I think we attacked this health issue from many different standpoints, legal standpoints, medical students, professors and providers. So it was very fruitful and very informative. And yeah, I really enjoyed it.
Yeah, absolutely. And I agree. Like, I think when you and I were putting the show together, we really were striving to have the most diverse group of panelists possible, not only in terms of the industries that you mentioned, but in terms of the representation. So part of the things that, BCPH really prizes is that diversity, is that social justice, not only the fact that public health intersects with, with clinical medicine, with social work, with law, with business, with all sorts of different varieties, but then the people that we get to speak, right? That we're not just having people who are professors or other physicians or nurse practitioners, but that we're having the legal scholars, that we're having community activists and advocates, and that all sorts of people can weigh in. So especially like episode 4, I love that we had the medical student representation, because it's not just people at the top, other clinicians or policymakers or people within, regulation or accreditation who can speak to this, but it's people who also are experiencing a lot of these things like on the ground.
Right, yeah, and that's why I think in episode 3, we spoke about how everyone's a patient in waiting. And for me, being a moderator, I'm having these conversations with professionals and getting their professional standpoint for them to dive deeper into their personal experience, I think meant a lot and meant even more.
Yeah, no, I think that's amazing that you would ask that point, like the expression of the patient in waiting. And so it's amazing that someone can be a physician, they can be a legal scholar, they can be a social worker, and yet they've had a lot of experiences with medical gaslighting or issues related to the cultural competency, responsiveness, or cultural humility or lack thereof with their provider. And we've seen a number of the implications that can happen for that, from like the number of suicides that may happen because someone's been has experienced medical gaslighting, and how serious that can be.
Yeah, and Dr. C, I'd just like to ask you, I'm a little curious, what has stood out to you throughout these episodes, or what are things that maybe we didn't cover that are burning questions?
Sure, absolutely. Yeah. So because top of mind, we just filmed episode 4, I'm thinking about when you asked the question about the different metrics that we can use, and ways we can hold the medical system accountable. I know Dr. White talked a lot about very macro things that we can look at in terms of readmissions rate or length of stay, or things that we can find at the hospital level and look at the institution or organizational level. But things that I think a lot about are things that are actually happening. And I think Antonio mentioned this in one of our first episodes earlier today, what is happening on the micro level. So when you're actually having that patient and provider in the office together, what is happening on as Antonio said, the cognitive, emotional, and behavioral level? Can we measure those things, right? Before we even get to what might actually be a lagging indicator of, readmission rates or length of stay, or actually like how many people are getting referrals or Black maternal mortality rates. But can we look at what are the actual communication happening between patient and provider? Is there listening? Is there disruptions, et cetera? Can we actually measure that? And I think about, AI and machine learning, and it's very possible. But yeah, one of the burning questions I had, like, just as we want to approach this from an individual clinician level and organizational institutional level, and then say accreditation level, but we may want to implement things on a micro level too. So that was like kind of a burning question as well, and not sure what kind of research is being done about that.
Yeah. And I think another Another thing that I noticed was the shift between cultural competency to cultural humility. And I think that speaks a lot to what we can conclude about this episode, is that modules and trainings aren't enough. And there's more that needs to be done. And that just comes with humility, being a human, having empathy, putting yourself in other people's shoes, and knowing that it's okay that you don't understand everybody's culture, but in your position, you would do anything that you can to ensure that this patient has quality care.
Yeah, absolutely, absolutely. And then this ties into one of the things that you asked at the last episode about intentions. And I think that's something I would want to highlight as well, that I think too many physicians and clinicians fall on the fact that they have good intentions. And I absolutely agree that is not enough. Just because you feel that you're a good person or that you didn't actively think I was trying to harm that person, that's not enough. We have to be able to dig deeper. And if we know that these disparities exist, for different racial, ethnic, gender, sexual orientation, immigration groups, etc., then obviously we failed with the good intentions. So we need to push ourselves much further than that.
Yes, I agree. Well, thank you for having me, Dr. Carpenter.
Yeah, absolutely. Thanks so much, Fatou, for helping to put together this episode. And I want to say to everybody else, thank you for tuning in. Again, the Boston Congress of Public Health looks forward to continuing to bring you seasons about the great health debates, having more intellectual, sophisticated, and nuanced conversations about things that intersect with public health and affect your lives, either personally and or professionally.
Thanks.
Yeah.